Good afternoon to all. Keshvi,
Yes, sir.
okay, we can start because as a 4 p.m.
Yes, sir.
Yes, we can proceed.
So, good afternoon, all present here. Respected GD sir, GD Gupta sir, Director cum Principal of ISF College of Pharmacy, Moga, Dr. Saurabh Kose, Head of Department Pharmacy Practice, and all the staff members that have joined us, all the students. So, today we have gathered here to observe the World Hand Hygiene Day that is observed on 5th of May of every year. And this year's theme is related to it might be gloves, but it's always hand hygiene. That emphasizes on the need for the proper hand hygiene in the healthcare professionals, even if they are wearing gloves. So today, our esteemed speaker, Mrs. Usha Rani, that has joined us. Good afternoon, ma'am. We are really thankful to have you here. She has done her BSc Nursing from College of Nursing, Tamil Nadu, and pursued to do her Masters in the same from Rajiv Gandhi University of Health Sciences, Karnataka. And currently, she is the Vice Principal of Apex Trust Nursing College. She is a passionate and exemplary nurse educator, having an expertise of near to 2 decades. She has guided various nursing projects, has been an author and reviewer of various nursing books too. We're really thankful to have you here, ma'am. Welcome.
Thank you so much, ma'am.
You may continue, ma'am.
Yeah. Good evening, everyone. I welcome you. I welcome you for this forum. I thank the management of ISF College of Pharmacy, Principal Sir, and Dr. Saurabh Koshe, Head of the Department. Then Dr. Matthew Divedi, Associate Professor, ISF College of Pharmacy. I thank everyone for this forum, especially for the faculty members and students. See, today we are gathered here to observe the World Hygiene Day. Sir, can you please share the PPT? Yeah. This World Health Organization, that is all you know, that is a non-governmental organization. It is a global authority on the public health. Its main mission is to promote the health and keep the world safe and save the vulnerables. So all this health promotional activities WHO is undertaking, and especially for the world hygiene, that from the 2009 onwards, WHO is emphasizing the importance of the hand cleanliness in the healthcare. That is mainly for to the self-care initiatives, mainly on focusing on the patient care and comprehensive quality care we are providing it. So every year, annual campaigns we are raising it. That is especially for the global awareness about the significance of the hand hygiene. So of course, in the 2025, this is the 17th year we are celebrating the global campaign. That is 2025. Our theme is it might be the gloves, but it always the hand hygiene. Still, we are using the gloves, but we are using the hand hygiene is very important. See, today we are here, move on to the action. Today we are not doing action, tomorrow we can't to cure the diseases. We are mainly here to promote the health of the community people and prevent the disease and control the diseases. Please, next. So all the countries collaborated with the WHO. They have taken initiatives along with the infection prevention and control. Now we are moving to the global action plan and monitoring frameworks. So especially for the WHO frameworks, 2024 to 2030, move on to next slide, sir, focused on wash, waste and electricity services. That wash, that means water, sanitation and hygiene. That we are concentrating mainly on the wash, that is water, sanitation and hygiene. So waste and electricity services we are providing, that is for to universal safe access to ensure the quality of the care. We are linking to the climatic changes as well as the health of the community people. So as for our policy making, we have to include in all the things, that is especially for the healthcare plannings, programming, financing, implementations and monitoring, we have to do it. IPC is giving enough support for us to implement all these things. Now we are in the way to move on to the action, especially before 2019 we made only awareness, especially for the see personal hygienes. We have to wash our hands before taking the food and after toileting, if we are whatever we are, wherever we are going, touching, then we are taking care of the patients. Only we given awareness about that hand hygienes. Once if we experienced during 2019, so that is especially COVID, that is a mass pandemic effect we had. After that we started to done everything, so we had that good result also. So now we are in the way awareness to the action. So gloves do not replace the need to perform the hand hygienes. So we move on to the action things. See here, I want to explain about that gloves. See, in the hospital setups, to prevent the infectious disease transmission, we are using the gloves. So it may be the gloves are infected with the blood and all this fluids exposing risk is there. But still, the microbial transmission from gloves is a major part. See, once if you are 4 to 5 minutes, if you are more than that, if you are using that, it's automatically the gloves are having the small pores that it will, that all the oozes are goes to your hands. It may be the chance of getting the transmission of infections also. That is one of the major part that, and moreover whatever the gloves we are using it, that we are discarding, that is a major biomedical waste occupying in our country. So that while we are burning the gloves, it emits like dioxins and furans, it's emitting, it's accumulating to our health problems, major health problems that may like a reproductive and developmental issues also happening, as well as harm the immune systems and disturbing the hormones that may leads to cancer also, because the PVC plastics are found in the medical devices like gloves and blood banks. So see, now we can move on to the status of the waste services in the healthcare globally. So the gloves, whatever we are discarding it and all the biomedical waste, these things that in the 2021 globally they given that report that is 54% of the healthcare facilities have the basic healthcare waste services. Although this is drops to the 31% in the least developed countries. So based on the 2025 data from 100 countries, 58% of the countries have published then up-to-date waste standards, and a further 32% with standards which require updating or finalizing. Still, we are in the way to collecting the updation of the healthcare this waste services. So next. So now we move on to the action, to the awareness to the action, that is promoting effective health hygiene. So next slide, please. So next slide, please. So next slide.
Please, Kamal, please change the
So
slide.
please next slide.
Due to
Just a minute, man. Just a minute. Yeah,
uh, there is a network issue. Please, sorry for
Okay,
the
no.
interruption.
Okay, sir. So that means we are in the awareness to the actions. Mainly we are promoting effective hand hygiene. We have to do it. So hand hygiene is a key measure in protecting the health, especially within the healthcare environments. Regardless of the gloves used, we have to go for the hand hygiene practices. In the 2030 agenda, that is Sustainable Development Goals, it is obtained by all the United Nations. Among 17 goals we are undergoing in especially in India, we are going that. In the SDG 3, that is Sustainable Developmental Goal 3rd, that is ensuring the good health and well-being, that is insisting. Then the SDG 6, that is insisting by promoting the universal access to the clean water and sanitation, that is SDG 6. So both if we are following or if we are implementing that, surely we can prevent all the communicable diseases, then we can promote the health of the people as well as the community also. So now we move on to the objectives of the World Hair Hand Hygiene Day 2025. Sir, is it okay?
Yes, ma'am. It is Kamaljeet is reconnecting. It take 1 minute. No problem. He
Yeah.
is connecting, ma'am.
So the objectives of World Hand Hygiene Day 2025, the first one is to promote optimal hand hygiene practices, that is using the appropriate techniques, and according to the WHO 5 moments, then the times for the appropriate gloves use within the healthcare flow is very important. That is optimal practices we have to do it, that promotion we have to do it, wherever we want we have to give the awareness, that is promote inclusion of the hand hygiene within the national IPC strategies as well as the standard operating procedures at the facility level. At all the institutional levels we have to make them to do the hand washing procedures as well as the practices, especially in the sub centers, then primary health centers, then community health centers, then sub-taluk hospitals, then district hospitals, then teaching medical college hospitals, as well as the private hospitals. We have to insist them to follow all the IPC guidelines and strategies. Then raise awareness of the environmental and climate impact of the gloves. See, of course, I said about that gloves, how we are disposing and how it is influencing the environmental factors, so that we have to give adequate awareness to the community people about that. Then next we move on to science behind the hand hygiene. Then hands are the most common vectors for the pathogen transmissions. Of course, the hand is our major transmitter. So the numerous studies we have to confirm that hand hygiene is the most effective practice we are doing it. Next. Then key scientific facts are there here. According to estimates by the Centers for the Disease Control and Prevention, approximately 80% of the common infectious disease illnesses are spread through the hand contact. See, in the hospital setup or it may be in the community, if you are not properly practicing your hand washing techniques, it's of course 80% of the infectious diseases are transmitting. Then proper hand hygiene can reduce the diarrheal diseases by up to 40% and respiratory infections by the 21% in the general populations. Then effective hand hygiene, it disrupts the transmission of the bacteria, that is MRSA, E. coli, then viruses, influenza, then non-viruses, that SARS, like non-pathogens, fungal pathogens especially. These all the communicable diseases are transmitting from one person to another person, as well as the nosocomial infections also transmitting if you are not properly practicing the hand hygiene practices. Then global situations and gaps. Despite its proven efficacy, see we are whatever the problems we are facing, still we are remains in the hand hygiene compliances also, is it? Especially in the low and middle income countries, still we are less than 40% only healthcare workers are using the health hand hygiene practices. Still we have to insist them to do it. See, it is less than 40% is very low number. Of course. So healthcare workers are the main persons to handle the patients. See, like they are cleaning, they are shifting the patients, is it? So we have to insist them to do it. Then more than one third of the healthcare facilities worldwide do not have the sufficient hand washing stations available at the point of care. See, that is very important. Infrastructure and facility what you are providing to the facility level, or it may be to the manpower, is very important. So we have to give adequate hand washing stations as well as these solutions we have to provide them to follow it. So that is very important. So these are all the some of the global situations and gaps are there. Many public and private healthcare facilities lack the adequate water, sanitations, and hygiene infrastructures. See, most of the hospitals, if you go, it's a very small hospitals are there. So maybe the scarcity of water, then sanitation is very difficult. Then hygiene practices is not adequate. So they may be messily, they will do the patient care, they will it's rubbish things, all these things they will do it. Please provide that all the healthcare facilities to the people. So it is that is also one of the gap. Then IPC breakdowns. So that is sometimes it may be the surveillance may be the breaking down because of lack of manpower, or it may be the materials because of that IPC also sometimes it goes to the breakdown. So these gaps not only the compromise the patient safety, but also you have to facilitate the spread of emerging and re-emerging infectious diseases. So these gaps will promote the or increase the rate of communicable diseases as well as the non-communicable diseases. So as much as possible, we have to reduce the gap. Then as Alvin knows about that hand washing techniques with the soap and water, all you are familiar with that. From the first year onwards, if you are entered as a medical professionals, the first we teach about that hand washing techniques. So first you have to wet your hands. That is very important. Then after that you can apply enough soap, that is, or it may be a solutions if it is available you can apply it. Then you can go for the rub hands, that is palm to palm you have to do it. Then you can go for the rub back of each hand with the palm of the other hand with the fingers interlaced. You have to do it. See, you follow the images, which one I showing in the screen. Then rub the palm to palm with the finger interlaced. Then you have to do it. Then rub with the back of the fingers to opposing palms with fingers interlocked. You have to do it interlocked. You have to do it. Then you have to clean it. Then you can rub the each thumbs. You have to clasp it. Then at the opposite hand you have to use it. Then you have to rub the tip of the fingers in the opposite palms in the circular motion. You have to do it the both hands. Okay. Then you have to rub the each wrist with the opposite hand. Then you have to do it. Then rinse hands with the water. Then if you have like a tap that close it, that with the elbow only you have to use it, or if it is not available like these types of taps, if you can take the tissue paper, then you can close the tap. Then you can wipe your hand with the towel. Then you have to maintain the clean hand till your procedure completes, or it may be the surgical hand washing. So whatever the things you have to maintain it till your procedure completes, your hand should be clean. Next. Okay, we seen about that WHO, then why they are insisting about World Hand Hygiene Day. Then we are seeing about gloves, we have to use it for a main PPE, that is personal protective equipment, we are using it. But still we are insisting them to use or practice the hand hygiene things. So here the WHO standardizing that 5 moments for the hand hygiene approach where we have to use the hand hygiene. So this is very important. So it is very defines the healthcare workers should perform the hand hygiene. This is a evidence based. See, as a medical professionals, wherever whatever we are doing it should be the evidence based. If I do this one, what I will get it. That is very important. That input, process, and outcome. So we are going in that process only. So that is then we have to go for the field tested. So that may be the trial and error we will go with, then we will get the findings, then we will go for the main study. So field tested, then user-centered approach is designed to be easy to learn, logical and applicable in the wide range of settings. So if we are applying in that, how much the percentage will increase or will prevent the diseases. Next. See, I said where we have to use it. The hand washing practices where we have to use it. How the WHO is insisting to use the 5 moments. The first thing is the before touching the patient. First thing is the first touching the patient. Then before, second thing is the before clean aseptic procedures. Then after body exposures or risk. Then fourth one is the after touching the patient. And fifth one is the after touching the patient's surroundings. So these 5 steps you should keep in your mind while you are doing procedures or while you are in the clinical postings. See, I'll give the example for that. That 5 moments where we have to use it. The first one is the before touching. See, I can go for the maternal mothers, I can give the example. So before touching the women or newborn, the example is before taking vital signs, you have to wash your hands. Then before listening to the fetal heart rate, you have to wash your hands. Then second thing is the before clean or aseptic procedures. So whatever the procedure you are going to do it, before that you have to perform the hand washing. So like before vaginal examinations or before cord cutting and clampings, then before taking blood or it may be withdrawing the blood. Then third thing is the after body fluids or exposures. So after completing the procedure, so you have to wash your hands. That is after vaginal examinations, after delivering the placenta, then after handling an invasive medical devices. The fourth step is the after touching the women or newborn. After we completed the procedure, we are making the women to comfort. Is it? So we are wiping the skin, we are doing bathing. So after that, you have to wash your hands. The fifth thing is the after touching the women or newborn surroundings. So environment is very important. Environment is influencing more. So after touching the women or newborns bed space, then after touching the women's chart at the bedside. So these 5 moments we have to keep in mind. Then you have to perform your hand washing techniques. Next thing. See, for example, so before we seen like a normal maternal thing we seen here, the patient is admitted in the hospital with the urinary catheter. So the how you will do it? So before touching the patient, we have to perform the hand washing. Then before cleansing or aseptic procedures, we have to do it. See, for example, the patient with the urinary catheter and drainage system. So when you will do it, so inserting or applying an indwelling catheter, intermittent straight or condom catheter. So with that time you have to, before that you have to wash your hands. Then assess the drainage system to collect the urine samples or to empty the drainage bag. So before you are planning for emptying the drainage bag, you have to do the hand washing techniques. Then third thing is the after body fluid or the exposure of the risk. So that is after you are collecting the samples or it may be emptying the drainage bags or removing the urinary catheters, that time you have to perform it. Then after touching the patient you can do, then after touching the patient environment you can do the hand washing practices. Next. See, like this is the post-operative ward. The patient is shifted from the operative bed to the post-operative. So where we will do it. So before touching the patient, then before we are doing the procedures like post-operative wound, or it may be the suture if you are cleaning it, or it may be the replacing the dressings. So that time before that you have to go for the hand washing. Then the third thing is after body fluid exposure or the risk. That is after post-operative wound examinations, sample collections, you have to do the hand washing procedures, or if you are after remove the stitches, or it may be after the bandage or wound dressings. So after that you have to perform it. Then after touching the patient, then the fifth thing is the after touching the patient surroundings. So here these 5 mementos you have to always keep in mind. Then you have to go for the hand washing procedures. The next thing is the innovation and behavioral change. Innovations and behavioral change. So still that hand washing techniques, if it is rises in our mind, that is a simple procedure actually. See, whatever the things we are going to do it, we have to wash our hands. So that only we are insisting. So of course not. See, if you goes behind that, the hand hygiene is a major part. It plays a major part because it is a basic thing. See, if you are not doing the hand hygiene properly, it is a major part or place to conduct the microbial organisms or transmission of the communicable diseases. So that's how it is influences our behavioral things, and how if we are going for the new techniques, how we can prevent it, the communicable diseases. Here, innovations and behavioral change influences that the recent advancements in promoting the hand hygiene practices, especially in the COVID-19, we are experienced. Then we are the evidential persons in this generation. We are evidenced with that. It may be in your olden days, your grandma, or it may be your granny. They may said that we had that a huge population of chicken pox, malaria, like so many communicable diseases. They may be affected, but still we are not evidenced with that. So whatever they may tell us, we are listening as a story, but we are fortunately or unfortunately we are evidenced in this century like COVID-19. So here the WHO is recommended alcohol-based hand rub 60 percentage that we have to use in that formulation. That is mainly to kill the microorganisms. Then sensor-based hand hygiene monitoring system in hospitals also we are using it like sensor-based hand hygiene monitoring, that is like Bluetooth beacons we can attach it. So through that, whether the healthcare workers, whether they are following the hand hygiene practices or not, it is monitoring and recording it in our system. Then behavioral change prompts, that adequate awareness we have to give to them. Then communication materials such as visual clues. See, visual clues means like it may be that we can provide the solutions the front of line areas. So the regular places we can keep it, or it may be the line of sight we can keep it. So as soon as we enter near to the bed we can keep the solutions, or it may be near to the door we can keep it. With the flickering system also we can use, or it may be any lighting systems to attract more. So where we kept the solution bottles, is it? So like that also we can keep it like visual clues. Then leadership modeling, see for example as a senior people, if we do the hand hygiene practices properly, maybe as our juniors also will follow it. Otherwise see like a senior, so he is going coming and he is not at all doing the hand hygiene practices, then why I want to do it? Like so many juniors will also follow the wrong practices. So leadership modeling is very important. So if it is autocratic or democratic, you can follow it. Okay. So that significantly, so these are all the things if we are following can improve the hand hygiene adherences, we can follow it. Next slide, sir. See, now we are in the advanced technology, that is AI, artificial intelligence, in everywhere, every systems we are generating, we are influencing, we are using it. See, now we are in the process of 12th result systems. See, all the students are meshing up with that, whether we want to go for the AI studies or it may be the tech studies, is it? Because they think that it has a more scope. So in our day-to-day life, also AI is influencing more. See, now in everybody's DP, it is their DP photo is turned as AI photos, is it? Now every day in practices we are seeing it here. Also our government is taking initiatives for the hand hygiene innovations. Also we are using AI. So with the AI adoption across the world, the healthcare industry also accelerated. We are introducing some scientific innovations for the five mementos of hand hygiene approaches we are using it. So next slide, sir. The first one is the AI-powered hygiene monitoring smart sensors which influence the compliances and infection control with the real-time feedback. That is automated hand hygiene monitoring. See, for example, that is we are using like a wristwatch. We are using it, is it? So that it's maybe the Wi-Fi connected. Then it is whether the sensor is attached, smart sensor is attached, whether the healthcare workers includes doctors, nurses, pharmacists, physiotherapists, then all the team members, whether they are performing the hand hygiene practices or not. If I use that hand hygiene practices, it is monitored and the sensor is recorded. He performed the hand hygiene practices before started the procedure or before touched the patient. So this is a real-time feedback we are getting through the monitoring smart sensors. The next one is the advanced AI-driven sensor technology that transforming the healthcare environments. See, for example, the hospital systems that may be connected with now the Internet of the Things we are connected with that. It starts from the hospital entrance, emergency department, it may be the laboratory or maybe the any specialty wards, then operative systems, ICUs, post-operative, then any specialty wards. Everything is interconnected with the internet. Then we are providing the care, then we are connecting the people with that HMIS, that is Hospital Management Information System. Then we are maintaining the electronic medical records. So as soon as the doctor visited the patient, seeing the consulting the patient, so immediately we are entered in the electronic medical record. Then that record is immediately seen by the junior doctors, or it may be the nurses or physiotherapists, pharmacists. Everywhere they are saying simultaneously what is the patient's problem, then what is that consulting they done, then what is the how the prognosis is, then what is the contribution we are doing by the healthcare professionals. Is it so? Entering the ward, then see for hand washing areas, we should keep it everywhere. Like hand washing, alcohol based, we can keep it, or soap based, soap with water, we can use it. So that we have to keep it. So through AI driven sensor technology, it is observing whether the healthcare worker is performing the hand hygiene techniques or not, whether they are using the alcohol hand rub or the soap and water. So it is recording. Before touching the patient, we have to perform it. Then after handling the patient, we have to hand wash like HHA or HH, but soap we can use it. So then you have to leave the ward. So this thing will be recorded. Then we are doing the survey also. See the B, then healthcare workers wear Bluetooth tags, we can wear it. So it is interconnected with the Wi-Fi all over the hospital. It is interconnected with. Then the bedside sensors also we are attached. See, if we nearly closely, if we are moved to the patient side, the sensor is detected. This we are having some special IP numbers and everything. It is read out like biometric. Everything is fixed. So this person came near to the patient whether he performed hand hygiene or not. So like the sensors are received. So through the Bluetooth signals. See you see in the picture like a healthcare workers that it is detected by the devices that through the Bluetooth signals in the monitoring room we are getting everything from the server whether the person is performed or not. Then we are doing the analysis how many healthcare workers are performed the hand hygiene practices and how many are not performed the hand hygiene practices. So it is easy for us to identify the transmission of what is the way for the transmission of communicable diseases. That easily we can identify it. Then if we are reducing the infectious rate, we can reduce the bed occupancy also. So this is our main criteria. So in all the hospitals, we have to reduce the bed occupancy rate because we are in the most populous country. In everywhere, the healthcare system, how much it is developed, the same way the patients are getting, the people are getting the diseases also. So they are in the need of healthcare system. So the bed occupancy rate, if we are reducing as much as we can provide care to the community people. Next slide, please. Then sustainable waterless hygiene solutions. Now we are in the advanced technology that every day we are facing the problem with water scarcity because of the environmental changes. The rain system is everything is gone, then it is altered everything. So now in the medical field, now we are trying for the waterless hygiene solution. With the global water scarcity rising, that waterless hand hygiene innovations like biodegradable, that is alcohol-based formulations and antimicrobial dry hand wipes, they are trying to make it like this Cleanster that is from the 2019 and 2023 onwards in the market. They are distributing like these products like waterless lotions, waterless body bath. These products now we are in the sale in the market in the hospitals. Advanced hospitals also we are using it, as well as these products they are using in the armed forces like in the central forces also we are using it. Then UV based hand disinfection machines that kills the bacteria and viruses. See, instead of using water, we can go for the ultraviolet based hand disinfections also using. Before we are handling the patients, we can show our hand under the UV light rays so the microorganisms will kill. Or else you can sterilize throughout the room because all the equipments, all this bed and pillow, is whoever is important for the patient, that surrounding is provided, is it? So that through the UV light we are doing the disinfections to kill the bacteria and viruses. Next slide. Then smart dispensers, then Internet of the Things, that is IoT hygiene compliances, assessors, then track sanitation rates among us the healthcare personnel. That smart dispensaries, that while you are entering the ward, so we may keep the hand washing equipments or with the soap and water, they'll fix it. So near to that biometric system is there. So it will monitor with the camera if the person is came, Mr. X with the with the number employee code, they can trace out whether he or she performed the hand hygiene or not. So it is by the smart dispensers also it is observing and monitoring. Then everywhere I said the whole hospital system is tracking with the sanitation systems. See, for example, the housekeeping people, whether they are which side they are turning it, how they are using the mop, whether they are adequately immersing with the liquid solutions or not, whether how they are disinfecting the ward, how they are disinfecting the bed, how they are disinfecting the wall, everything is monitored by the camera. So how much time they are doing it, whether they are cleaning properly or not. So all these things are connected with the Wi-Fi system. In the record room, we are observing and monitoring. So this is called a track sanitation system. We are doing it. See, for example, see in these images, hospital management, then screening and testing, then detect wearing of the mask and social distancing, then quarantine management, then delivery of the food and medicines, then robot assisted surgeries, disinfective and cleaning, then elderly and physically impaired care. So everywhere we can using these sensors and actuators, we can use it, then we can assess the people and monitor them, monitor the healthcare workers, how they are performing it. Next slide, sir. So whatever I explained before, that is through the AI system or it may be the Internet of the Things. If you go and search it in the NCBI or it may be in the PubMed, the lot of supportive studies are recently they done for the last 5 years. The sensor-based monitoring of the hand hygiene in the hospital of an IoT based systems that like especially in the Eastern Switzerland Children's Hospital, they done this movement profile that is reliably adherence profiles for the hand hygienes they used. It is a more costly system only, but through the sensor system they done the studies, then they performed it. So here the Bluetooth beacons they are used it for to monitor the hand hygiene, whether the healthcare peoples, whether they are following or not. Then the second thing is the efficacy of the visual clues to improve the hand hygiene compliances. So nearly the 75 physicians and 75 nurses are participated in this study. They randomly they may be assigned. Here they are taken as a 4 group people, then control people also they taken in. Because in the control group we are not doing any manipulation over there. Only for the case groups we are doing the manipulation. So that we are taking as the 4 groups we are taking it. The first group we are keeping the baselines. So the hands hygiene solutions we are keeping in the baseline. Then the line of sight also we are keeping it. Then another thing we are keeping it with the baselines and flickers. And third group we keep it as line of the sight and flicker. The fourth thing we can keep it as warning sign. If they are not performing hand hygiene, the warning sign will be, it may be the alarming sites, it will be there. So we can easily identify this healthcare worker not performed the personal hygiene before touching the patient. So like through these 4 lines we monitored the healthcare workers. So at the end we got that statistical data, that is the mass change is there, like the line of sight, the 53.3 percentage of the people are used. Baseline and flickers, that is 60 percentage of the people are used. Then line of sight and flickers, 66 percentage are used. Then warning sign, approximately 93.3 percentage of the healthcare workers are performed the hand hygiene practices, because the massive, that high rate of performance we got in that. Then the third thing is the Internet of the Things based hand hygiene practices, that the compliance is monitoring. that is system and validation of its effectiveness in the hospital environments. Here, the healthcare associated infections is the most common adverse medical effect. Here, HAI is a very risk factor actually. So it may be the nosocomial infection, the disease transmitting from one patient to other patient, or it may be patient to the healthcare workers, or it may be from the healthcare workers to the patient. So it may be, these are all the things are possible risk factors. So how healthcare associated infections may occur. So the only thing is that, so how that hand hygiene we are performing with soap and water, then hand hygiene with rub this alcohol based solutions. So whatever the things, whether the healthcare professionals, whether they performed or not. So this study is conducted in the Taiwan. So the major part of the people, that is 72% of the accuracy in the healthcare practices, we got that as a result in the intensive healthcare unit. So some of the supportive studies are more regarding the healthcare practices. Next please. So, what are the things that innovations, practices, what we are doing it or what we are trying to do it? So, what are the things also? We should have some strategies behind it, or we may have here some national and international policies and guidelines. We should have it at the national level as well as the that district level and state level also. So the policy strengthening is very important. So national, that is infection prevention and control, that they are giving a maximum guidelines, they are giving it, then we are prioritizing the hand hygiene things as a mandatory performance indicator. So they are providing, or they are submitting the report globally to the WHO also. So next thing is the infrastructure investment. See, in all the facility levels, I said before, we should provide the hand washing area. We have to provide to all the areas and wards, as well as the hand washing materials you have to give to them, to the healthcare workers, especially for the housekeeping peoples. Then you should give adequate awareness to them. The training session you have to perform it. So you have to make them to train it. Is it? So that continuous monitoring you can do them. The housekeeping supervisors continuously monitor them whether they are doing proper hand washing techniques or not. So that regular IPC training, then refresher courses for the healthcare workers we have to give it. Then community engagement, that is public campaigns you have to conduct it, especially in the areas with maximum exposures like schools. So as a school health nurse, or it may be the healthcare workers, so we have to concentrate on the school health, because in the school the under 18 kids are there, they are the freshers, they don't know how to handle, then they are the main transmitters actually. See, in each classes it may be the 20 to 30 students are there, so they may be close to each other, then after getting out the school they will go to the house. So whatever they are getting the infection from the school, that they are transmitting to the family members, or from the family members they are transmitting to the other children, because they are having very less immunity. They are the easily susceptible people to transmit the infections from one person to the other persons. So of course, especially in the school, we have to conduct the awareness programs, make them to perform hand hygiene practices. Of course, in the malls, that is a big crowd will be there. So wherever it may be the steps, or it may be the main areas or the entrance, we have to keep the hand washing places point, we have to make it. Then transport hubs, then see, this thing is not only the one day program. Today is the May 5th, so we are observing World Hand Hygiene Day. We are conducting some seminars, workshops, role plays, or mime shows, whatever the things we are doing it, we are enjoying it, but we should not closing this day in a one thing. Is it? So this is a lifelong process. On each way, each and everything you have to follow it, the hand washing procedures. The next thing is the monitoring and evaluation. So at the national levels, then district levels, state levels, then the international level, they have to monitor it. the hand hygiene practices, how the diseases are transmitting everywhere. The healthcare systems are there, that health departments are there, health secretaries, health supervisors. See, everyone should take the responsibility, that individual responsibility, social responsibility. They should take it. They should reach to the facilities, then reach to the healthcare workers whether they are performing the hand washing techniques or not. So that we have to monitor, auditing it. So you have to make them to do it in the proper practices, whether they are following all the steps or not. That you have to monitor it, auditor it. Then you can give the, see, so many systems are there, like ISO, like NABH, like NAC. All the systems, first they will see the basic hygienes, how they are maintaining the healthcare systems, or it may be the institutional levels, is it? So the basic line, if we are performing, if we are observing very good, the higher levels also it will be very clear. So that is the best benchmark for us. See, till now we seen about that all this. See, I think I may be clear. I may be covered all these things regarding about the World Health Organizations, and how, why we are not concentrating on much more the gloves usages, because that is a biomedical waste we are getting more, as well as the status of the healthcare waste also. Then how we are concentrating on the SDG, that is Sustainable Development Goals. See, we are in the Sustainable Development Goals, we are concentrating on educations, infrastructures, then development of our each state, that is water facilities, sanitations, environmental hygiene, everything we are concentrating at, is it? So what is the science behind the hand hygiene, then key factors, then global situations and gaps we see, then advanced technologies, that is AI also, how the innovations are here influencing, then how making the people to do the hand washing practices, how we are monitoring, then auditing it. I think we covered every part of the hand washing things. Then how much we can promote the universal care, that is very important. Universal accessibility of the care is very important, that whatever we are providing it, that should be acceptable to them also. So that is, we are as a healthcare professionals, still we are in the baseline of primary health care. So as you know, in the primary health care, they are insisting about the essential health care. It is made universally for accessible and acceptable for everyone at the free of cost, or it may be the affordable cost we have to provide it, is it? So if you are providing hand washing solutions to them, it is affordable cost you can provide it, or it may be the free of cost. So that is depends upon the facility, or how much the your budgeting system is allocating to you. So that is very important, as well as the health teaching is very important. So awareness we have to make to them. So all we as a healthcare professionals, in spite of doctors or nurses or pharmacists or physiotherapists or social healthcare workers, or even a scavengers, a sweeper, or security person, don't bother about anybody or any designations. Please don't bother about the things. Only thing, we are here to serve the people. We are here to serve the people. We are here to protect the community, to prevent from the communicable and non-communicable diseases. So all, let's we commit together to clean care for all. This is our basic logo for us and motto for us. So we can implement the evidence-based actions, we have to implement it. So see, whatever the burdens we are having, our disease burdens, communicable disease burdens, here in the world we are facing so many biosecurity threats we are facing. It's even now Pakistan, India, fights are going on everywhere. Is it, so many people are affected with that. So see, so many people are injured, died. So immediately the injured persons and died persons, we are shifting to the hospitals, army hospitals, military hospitals. See, the hand hygiene, if we are doing it, we can survive the people. So that is our first line defense. Please keep in mind, the hand hygiene is the first line defense of all the healthcare personals. Thank you all. Thank you for your patience. Till now, you listen my talk. Then thank you for washing your hands also. Thank you all. And given the opportunity that ISF College of Pharmacy, it's overwhelming that I think, of course, I utilized this platform itself. Then I adequately I given the information itself. Of course. So thank you for giving each and everyone given the opportunity. Thank you, sir.
Uh, Very thank you, ma'am. Is there any question from audience? Well, ma'am, we have our director, sir, Dr. G.D. Gupta, sir. Sir is
Yes,
our
sir.
director cum principal, and I request to my director, sir, please give some few words on this occasion.
Thank you very much, Dr. Madhavji. So, first of all, I am thankful to Madam Usha Rani ji for provide this opportunity to interact over here. And as you know that hand wash is the one of the most important things. Most of the disease they can be moved and passed through the hand. So you have taken each and every parameters, not only the simple the hand wash technique. You have used over here all types of the techniques, handling of the patient, handling of the Y products, and how we can utilize the equipment for the proper cleaning of the hands. As per the WHO guidelines, without any reason, each and every person touch the mouth with their hand near about 23 to 25 times. And any article, whatever we are the handling, even we are handling the laptop, table, gates, door, everything, whatever we are the handling, always we can touch the hand. After that, without or ignorance, we can touch our the mouth. So mouth is the one of the source of the contamination near to the eye, near to the nose, mouth, and the ear. All these things are the source of the you can say one of the disease problem. And hands have sometimes we have some rings, sometimes of the nails is the not proper is the cutting. So there is the one of the big root of the contamination. So you have given the one of the wonderful things, and I feel that you have the capacity and you first time I have listened this type of the lecture near about the more than of you have given the 55-minute continuously related to the hand wash. So you have take the each and every aspect which is required for the proper of the you can say technical manner as well as the professional and you can say for the health profession like that. So I am highly thankful to you, and I hope that whenever you are the doing or the handling of the patient, number of time I feel that sometimes we are taking or ignorance it may be the take place during the operation system, during the handling of the patient, and during the handlings of their clothes. So many things it may be possible. So Madam Usha Rani ji taken each and every part in a very scientific manner, including you have taken of the UV, how we can use the UV light for the cleaning or the free from the microbial contamination of the hands. And whole of the country and whole of the world lot of aware about the COVID-19, because before to the COVID-19 only the few person is the aware about it. Now the throughout the world we can the aware about the how to do the hand cleaning. So thank you very much for the coordination team to provide this opportunity for this listening of the wonderful lecture. And I hope that what is the big thing and what is the small thing, there is the no meaning. Thing is the here how we can justify and technically approach the thing. So this is very important topic, is very simple. Hand hygienic or hand cleaning, this is very simple. You can clean by the soap, you can clean by the water, rinse with the water, and you can clean use sometimes of the 60% of the alcohol like the sanitizer like that. But not only this is the very very sensitive issue in those days in the hospital condition. Even when you are using the gloves, but when you are the removing the glove, when you are the wearing the glove, each and everything you have completed up to a certain you can technical manner. So this is the wonderful to listen to you, and continuously you have give your full of efforts for preparation of this lecture and delivering of this lecture. So thank you very much, madam, and I once again welcome you and thankful to you for accepting our invitation and provide this opportunity our whole team, students, and this lecture it will be the recorded and also available on our YouTube channel. So most of the people they can go through it and they can also come to know that so many new steps and so many new things for the hand cleaning life of the purpose. Thank you very much.
Thank you
Over
so
to
much.
the Madhavji.
Thank you, thank you, Director Sir, for your golden words for me. And over to Kesvi, beta.
Thank you so much, ma'am, for this inspiring and impactful presentation. I hope this will be the most memorable presentations of all for us. So thanks for addressing the issue of biomedical wastes too, along with the optimal hand hygiene, the gaps in the global scenario that we are facing today, and the user-friendly, evidence-based approach to hand washing that we all needed to know about, and how the innovative changes that are taking place after the pandemic and how can we validate and monitor those. So this was all very good to know. This was all new to us. So I'd like to invite Dr. Madhav for the vote of thanks. Please, sir.
Thanks, Kesvi. First of all, I am really once again very thankful to ma'am, to Sarani ma'am, to give us their golden time for us to give this such a knowledgeable aspect of this hand hygiene day. And I am also thankful to my ISF management, Dr. GD Gupta sir, Principal Director of ISF College of Pharmacy, Dr. Siddharth Mehan sir, IQAC head, and my head of department, Dr. Saurabh Kose sir, and all faculty of pharmacy practice, and all faculty who is listening this guest lecture of ISF College of Pharmacy, and all those lovely students who are listening this very important and dynamic topic. And few things I want to give you, ma'am, for you, as you are nursing professional. And I have seen one word for you: caring hands and healing hearts. Caring hands and healing hearts. This is the quote I want to give you the all nursing fraternity, because you are going to celebrate International Nursing Day on 12th May. And during my PhD, and I worked a lot of nursing staff in my CTBS Cardiac Care Center in Gitanjali University. I have done, and I really thanks to all nursing fraternity, all nursing staffs, how they have give their impact to the students, and timely they respond to save the lives. Because doctor is coming, they take time 3 to 4 minutes when there is emergency. Nursing staff is there by the 4 and 6 hour internal duties, and they have given a lot of things, ma'am. And definitely, we are the healthcare team, we are the pharmacist, and all from the all pharmacists, I am thanking to all nursing fraternity, ma'am. Thank you so much, ma'am, for giving us time. We will send your all of your certificates and things to you, ma'am. Once again, thank you, ma'am.
Thank you, sir, for welcoming me in this forum. Once again, I thank for the management.